The talk where they come to you live from the Society for Radio Democracy 98.1 FM. Well, Body Talk now program where we come to you every Thursday from 5 to 6 o'clock even 10. Inside the program Well Body Talk, we dey talk about different sick them, wetin dey cause them, treatment, prevention, and self signs and symptoms. As inside the program Well Body Talk, we dey always get experts in the studio where we can talk about different sick them. And inside this edition of the program Well Body Talk, we studio guest now Dr. Jamilatu Rahman, in the resident Doctor Family Medicine Department, na the University of Salon Teaching Hospital Complex. And today inside the program Well Body Talk, we dey talk about how to manage common infectious disease during the rainy season, waiting every family for know. Remember say inside the program Well Body Talk, you self when they listen and watch you live na Facebook, you go be part of the program by way go send a comment or text message to the number 077-981-981, or self you go now where the Democracy Facebook page. And later on inside the program we go open phone line. Also you go call the number 077-981-981, 077-981-981, and the number where you go call later on for ask question about the topic we dey deal with today na the program when are how for manage common infectious disease during the rain season and waiting every family for know. And with that, I want to welcome my studio guest when are Dr. Jamilatu Rahman. Good evening and welcome to the program Well Body Talk.
Thank you.
Welcome again once more, as this is now your second turn at the Well Body Talk program. And today inside the program Well Body Talk, we dey talk about how for manage common infectious disease during the rainy season, waiting every family for know. So start for tell family and first waiting na infectious disease.
Okay, so when we talk about infectious disease, then we basically they talk about any sick way na what we call pathogens, then they cause them. Okay, any sick way pathogens that they cause, and when we say pathogen, we mean harmful to them. Okay, we then they around we, then they all around we then get way for enter we body, then they cause sickness by way. So now the same we mean by an infectious disease. Now the tumbo the way they exist around we, then find way they enter we body, then cause sickness inside of we. That's an infectious disease then.
What is that some of them tumbo then?
Yeah, and some of them we get different kind of. We get the bacteria them, we get the virus them, we get the fungi them, we get the parasites them. So all, and they all get different kind of. They cause different sick them. Some them go cause sick. We go affect your respiratory tract. That now also you they blow. And then one day they can give us what we go say this you get cold or you get cough.
Okay.
We get one day we go affect the belly, you go cause waiting, we go say na some kind na gastroenteritis or warm belly, you go cause belly hurt, your belly go run, all them symptoms that they related to the belly. We get some we go na the aid, it cause symptoms then with behavior them, and we with aid. You get some we go kind of the skin, it go cause symptoms in our skin. So it just depends on who side and the body they affect. I should say although able to get up infection. Okay. Some then go affect the who side person they wet. The genitourinary tract, so they go say you don't get UTI where it wet, it go they burn, it go cause symptoms, instead go they cause some kind belly heart. Some go affect the reproductive side, so then the back it will cause symptoms back then side and it. So it just depends on who side then go fashion per you, who side then infect per you.
Okay.
And that kind of symptoms they it go manifest. But we they talk about the one that we common in the rainy season.
Okay.
So during the rainy season we all know say the water and the dirty all lengths and they put together can cause certain sickness they way boku. Like one of the things we boku during rainy season, so we rombele business.
Okay.
Right? They find out say people that they get boku issues them we get for do with belle they run. And as we say, different kind of them harmful to mood and they. So we get bacteria the way they cause their rombele business then they. We can get some virus back where they cause their rombele business then they. So then they get a lot for do with sanitation, the way how we they take care of the environment them. As rain they cancel and that 10 days some man they go pull all in dirty way we don't get that something for the past 6 months.
Okay.
He can't to wear. So man at that 10 days they can't empty in toilets now do.
Well, we'll look at some of the issues then they later on inside the program. You mentioned say rombele and other things them. So how are we able to differentiate between the symptoms of common viral infections and disease and other disease them and other infections them?
Okay. Like for most times for virus then then they cause sick that we can be self-limiting.
Okay.
Where we say self-limiting, we mean like it come on, you they get the symptoms and like for example, so now if it calls for make you belly the one. Now let's say because quick one, we say we look for self-medicate in this country. 2 of us,
Two.
So man as he gets irombele, so he probably don't go take what if you say if I take a lot of the times people they take flagyl, then get the other one the back where then he take one called medicine him then they are too much anyway. Antibiotics no they work with viral anything we get for do with virus them they work. Yeah. So and then on the self-limiting, whether you take you take anything or not, then they run then cause if now 2-3 weeks then cause they run for after that time they get better.
Okay.
Then for the bacteria them then get different way how then they present you. Then you go get your belly out, your belly go they run. Sometimes some bacteria then they where they affect the belly so we they go na toilet you go they pull the diarrhea. That's not the water toilet. You go see say it gets something like a snot param, or sometimes you go see say it they come with blood and all that and they go sometimes you go see say your body go they warm all that and they point more towards their own side, the bacteria their own side.
Okay, so now let's look at what are the most common infectious diseases that we before be aware of during the rainy season.
Okay. So the most common infectious disease that we for be aware of, the one, in fact, the first one where I think I will talk about now we all, I don't want to say paddy, but we all sabi we all used to we all get or we all don't get now we own body malaria.
Okay.
So during the rainy season, the case of malaria they increase. And malaria in na a parasite.
Okay.
And they cause the malaria. And this parasite here na inside the mosquito. Now where the mosquito bet you, now it give this parasite here inside your body and make you develop the sick malaria. For go further with relation to the rain season, again we come back to the way how people they take care of the environment. During the rain season, the dirty. The rain they can't wash dirty. We all know say during dry season you go they pass through, they see them gutter then dry, not also. They see water they settle inside gutter. Rain season now we the pool we bath pan then we drum them, we try forget our water, then the gutter themselves because of the dirty we don't they can't settle now the gutter plus the water all now they so water they settle now all them places then they and waiting mosquito lake. Na stagnant water way settle, water way not the flow, water way stagnant where they one place.
Okay.
So if you don't pull your drum now, also if a man you don't cook down, you open in tomatoes, you just the fling and a grown. All them small container then they where they know they use, where then they come, water they settle inside half side and they then flower pots them, them dustbin the way they left open, them buckets them. Then tire them with water all they settle inside.
Okay.
Where the rain they come, water all don't settle inside. The water no they move, it's stagnant. Now the breeding ground now they for the mosquito.
Okay.
So then under the mosquito, then comfortable for go born. So then get fine breeding ground, then they born a lot during the rain season where they don't get all in fine place and then now and comfortable side. And the more mosquito you get, say there now, and then they told the plasmodium, this parasite here, they go bet you, give you, bet you, give you. So the more that they born, the more safe, then safe get for it. In the evening or any other time, then self they find shelter at the end of the day. Where they don't bond on, they get for find shelter. Not to do no more than get for left. So when you self they go inside your house, the mosquito self they follow you go inside your house. And then self one warmth. Where you lay down they sleep, your body warm, your body, you feel fine, cozy. The mosquito, you self when you they feel cold, you they find cozy environment, the mosquito self they can't cuddle near you. They say fine, make I can eat now. Now so then the bet person and they give you they infect you.
Okay.
So now one of the reasons now they make mosquito business related to malaria business where they go on the increase during the rain season. Then what are they?
Okay. Continue for the with me now the program. In name now Dr. Jamilatu Rahman in the resident doctor family medicine department at the University of Salon Teaching Hospital Complex. As in there so today for talk about how for manage common infectious disease during the rain season waiting every family for know. The program now well body talk they come to live from the Society for Radio Democracy 98.1 FM. Remember say yourself where they listen and watch you live now Facebook. You go be part of the program by way go send a comment or text message to the number 07798191. Or if you go now where the Democracy Facebook page. And later on inside the program we go open phone line.
Give the mosquito chance for turn your own environment to a home. And one thing and the way possible able for do. Another thing we possible able for do, them mosquito tents there. They're very effective. Say government we don't be the give them tent and not so.
Okay.
So man, God knows what he do with you. Make use of the tent and they hang them, sleep under the tent and they prevent from making the mosquitoes are not able for can cuddle near you and enjoy your blood and that's where you they sleep. So now things and then also then insecticide then spray. Now boku can spray then they get spray tags or wastox, tiger, this, that, all kind spray then they now. You can buy, although it's a bit expensive. But if you can afford it, buy, make sure say you they spray, they kill the mosquito them. When you spray, you lock you do not. Another way. Or them mosquito coil them back sometimes. You can use them where it kill. Make sure say no more you don't sleep with them on.
Okay.
Sometimes if you say they go lay down by 8, you go light them by then 6, 7, at least say you don't circulate well, you don't do in work. You put them off and you go inside, you go lay down. Then they also get drugs them where they call prophylaxis drugs them, medicine them where you they take them for prevent for make get this malaria or may malaria no if you don't.
Okay.
So you can take them one day, but that day you go need for go to hospital for go talk to your healthcare provider or go talk to your doctor, whosoever you they see. They go prescribe them for you, especially if you get picking then they get waiting and go you. They can give for them belly woman them, is standard na part of the your regimen. So now things and the way you can do for help for prevent make we not get sensitive.
Dr. Jamila, to this night in season, waiting at the food them or drinks where we for avoid for say we not get infectious disease.
Well, I go tell you waiting una for take. Clean things them make her just put under already.
Okay.
If you eat vegetables or you fruit them, make sure say you they wash them properly for make you not get in, because those things they can be contaminated.
Okay.
So you eat them kind of thing then you might get infected with something where you don't know. So make sure say you eat whatever you eat, it clean. It comes down mostly back to you sanitation. Where you they cook your food properly. try for the avoid for the eating at street as much as possible. You don't know how that person they prepare in food. You don't know how the person prepare in food. You don't know usai a left arm waiting be don't go sit down there. You don't know really waiting happen. So try for make your own food as much as possible. You water where you they drink. Make sure you drink clean water. During this rain season, you know say now na packet water all man they drink. But some man during rain season it dey cut cost, which is understandable.
So you find for drink clean water?
I dey can't me sister. When you don't get that you water, go boil am.
Okay.
I know say we believe say now from God to man. But the problem is before the water they reach you down here, you don't pass through so many things there.
Okay.
That roof way it dey knack before it dey enter you pan. You know how long that roof they be done there. You don't know whose body they be done can toilets at that roof day. You don't know whose germs or whose pathogen and they then pipe the all way it dey pass inside the can inside your bucket. You don't know the dirty all way it dey was can give you. Even the atmosphere, the air around you, you get germs the way they fly all around you.
Okay.
Where the rain they can do it they was salty bring and can down for you. You collect in a bucket, you say now from God to man. No, if we don't go through Motaman filter, so it not that pure anymore. So try for the boil them water then they where you they drink am here. Even where the rain they can where it they knack the ground. You see where when they knack the ground, it they splash. Not only that splash they elevate things then at the ground. Things that they rise up from the ground. So all of Nande, where you don't get that you water, go boil am first. You left am where it cold. Then you can you clean container them before you go drink them. But no make that mistake they say how the rain can on how you don't collect and so that's no more you for take them and drink them. Okay? So basically just try for eat nutritious foods. Yeah? Try for eat nutritious food, a well healthy balanced diet. You want to eat your fruits, you want to eat your veg, make sure say you clean them properly. Don't just go take the water inside the buckets back you wash out. Not so enough for toast that in water the back too much.
Okay.
Wash things properly before you eat them.
So normally we can say like during the rain season we can get plenty konkuba where they go in for konkuba gun soup. Where they normally then they can say can make they get a frequent stool. So then they again get any effects.
The reason why make people they get frequent stool, it will be say something they because okay. You don't ever make kokuba gun soup for yourself now, us?
Yes.
You better be gone. You see the point? You don't get any problem. Why? Because you make them properly. You clean everything. Now you make them. You know how you make them. Right? You take care of them. So you not get issue with Nandi. So if you go eat you belly on, you question the hygiene.
Okay.
Yeah? And the thing about infectious disease them.
Okay, continue for the with me now the program. The program now well body talk. It come to live from the Society for Radio Democracy 98.1 FM. Remember say yourself when they listen and watch you live now Facebook. You will be part of the program by I go send a comment or text message to the number 0779191 or self later on inside the program we go open phone line or side people will call the number 0779191 and ask question about the topic where they deal with today at the program when how for manage common infectious disease during the rain season waiting every family for know. So you go call the number 0779191 ask the doctor waiting you for know during this rain season waiting for it and how for prevent some of the environment and some of the things them where they drink during this rainy season. The program now will body talk well now inside the program Radio Democracy. We reporter Janet Masako been talk to different people and now free turn but waiting they know about infectious disease and self waiting at some of the things they waiting for be waiting at some of the things they waiting for know during this rainy season. Where then talk more to a reporter Janet Masako.
So when it comes to rain season, you see that time where the weather it can get your own way. Some of the things we go be experience. First of all, diarrhea left for day because some of the eat so okay, eat that treats cholera left for day, typhoid left for day. The kind of treats food them where people like can eat key result to that. Gronich, you can walk inside water where the rain can come. You go give gronich. Also, you never experience cold, running nose left for day. There's incidents for like get high pressure in the sense for like get irregular body temperature. Your body go the warm and all and other things them. Yes, so when it comes to this, you see get well body people them who you go to talk to in case you experience either which. So anytime you know say something to go down well, you can reach out to you go to pharmacy, not follow up a doctor. Either you go to pharmacy or you go to the hospital within near to you and get for talk to the well body person. It will tell you how to go about them.
Basic one, they're like, malaria, typhoid, and rumbele. Yes. I just go advise, say, like, whenever they use water, because it can happen back for them, water side, so man can just go take water and drink. So I feel say, thing like that, you go just, whenever you go take water, boil and travel boil and before ever you drink.
Well, one we will say cholera, cold, flu, and the reason like what it can cause the cholera more at the dirty at the country. Now side more at the country dirty and the rain business they cause all down the back for me cholera can at the country and cold more for them picking there. Well, they advise more for go hospital. More like cholera, not to see where they play with and nas they spread fastly. And cold back enough fine for picking, even for with the big one they back enough. So I can advise anybody where you get her no hesitate to go to hospital.
Na cholera. Go, so we in season don't come the water business. Because boku water not pure like the then where they can depend the water, they able boil them and the poto like how they go off cut back. Say them poto everybody they mass the water, go niche. Don't see. But man, they take care of the water where in they drink. So that in the end it cause that cholera. Some food and back where they eat, for very be careful, like them fly, come out, camp at the food. They able for take care of your arm, for wash your arm, like where you want eat. So some of them things and they all they cause that cholera. Don't see. But me advice where I want for you come pick them. You for take care of your picking, like where you picking they play, make sure say like where you want get food, let you wash your hand. And if you take care of in water bottle, like so picking they come out school, just they can pin in water bottle, they able to take care of her for wash them and boil them back. It's one water. I don't see. Then thing they all they cause cholera. For be careful the thing what we they eat. See, I'm doing this rainy season. Now for what they do, now that they go help we for push cholera far away from we. So man they rush up for go to picking our hospital because then most of them thing are rumbele, we can catch you. So man can waste time with picking our house. So the time away they say like rush up go to an hospital, all that thing don't happen. But me advice what they give, you get you picking, you see like them symptoms and they go with an hospital, you go get solution.
Well, that's not some people in a free talk. Me they talk to reporter Janet Masakoy. Also, them me they talk about waiting they know about infectious disease and self waiting. Now some of the things they wait them for do during the season for prevent them not for get in contact with an infectious disease. Yeah. The program now well body talk they come to a live from the Society for Radio Democracy 98.1 FM. And where they bring this edition of the program well body talk come to you, my name na Kaifa to Conte. Inside the program we still get Dr. Jamilatu Rahman in the resident doctor family medicine department na the University of Salon Teaching Hospital Complex. As today inside the program well body talk, they also for talk about how for manage common infectious disease during the rain season, waiting every family for know. So Dr. Rahman, you don't listen to some people but waiting at some of the things they don't know about infectious disease and waiting them for do and self prevent themselves not forget the infectious disease. So waiting go be your response to that day.
Okay. Firstly, I need to say the people they know, then get good idea from waiting and listen because they talk about hand washing, for take care of your food. Somebody mentioned for take care of your picking a water bottle. Make sure so it's clear. People then get idea. They no say hygiene na the key. They mention cholera and all the things in there, and all of it comes down to the hygiene, really, because now waiting you pick, you put inside your mouth, now in the cause for make you get symptom inside this belly for cause one belly.
Okay.
That's the way. That's how it work. So if you make sure say you dey wash your hands properly, you make sure say you dey wash your food properly, you cooking utensils them or whatever it is you they use for it. You pot, you plate, you spoon, you picking a water bottle, which a very because water bottle now something where it really tricky.
Okay.
And aside where them bad to good and they able for settle and grow. Because then one then they usually like moisture, they like usai wet, they able for thrive they live they multiply
Okay.
then they live there well. So imagine now water bottle. So now very good side for them for make them enjoy themselves. You picking go just they swell and they go just they make some man in picking on belly no they ever done. All tell you get on belly, all tell you get on belly. But if you check really na the hygiene. So I'm happy people then get good idea about that on belly side. They even mention typhoid.
Yeah.
Which also now fiko something instead of now what you eat now through you food now you they get them. So also it also get for do with hygiene, how you they take care of yourself. You waste disposal or we waste disposal. It's a problem. We get for learn for dispose of we waste. We toilets make her talk and fine.
Okay.
Properly. Then the key thing pandenting there. Because we they left the toilet open. Some man they go, he see button picking, you know they wash and properly. Some man not they even wash and some man arrange and you know they use soap. Some man they just they wait pian back na the lapa and move on with in life. Or incessant, all lengthening and then a big problem. So we get for ensure say we you toilet whether now na latrine or na bucket whatever it is you they use you learn for cover them then fly themselves where they can then tin up they then pick waiting they then go tin up back you sit on there they eat you posh fine food inside your office one fly manage for enter na ya you see the problem. So they pick they pick usai they go usai they land. It can happen to anybody.
Okay.
Sometimes you go they wonder I don't eat anything waiting I do I don't eat anything you don't know what be done she don't pay. It's that 1 second way you be just tonsil and tonsil. So hygiene so not a one person problem. You go they take care of yourself, the next person or they take that much care.
Okay.
You could probably hand ma talk about this shakan we like for shakan. Make we avoid for the shake we and them at this country.
Okay.
Shakan na real issue. Because that person where they can shake you. Not for the now we all know not for the shame again for people them. That person where they can shake you and or maybe even me I be don't do something with this me Anya I no member I not take proper care of my hands. Now I can't shake you and I can't leave problem for you. You take you fine bread or you whatever you touch them you bet them. Problem. So another thing where we for try for avoid as much as possible then unnecessary contact. Sometimes
Okay.
it's not really necessary for the touch people them or for the touch things even the surfaces the way we touch we get for try for minimize the thing and they as much as possible. Then somebody talk about cold no stay on irregular body temperature. Talk about the temperature where the rain they come, especially maybe if you get wet your body temperature could drop obviously. We
Okay.
place cold if rain don't soak you the body temperature must go down small. And sometimes that temperature the way they go down it affects your immunity because when the temperature drop your immune system not able for function optimally like not able for function the best possible way at its best. Okay so now they give chance for make you easily catch something and you manifest symptoms then or maybe sometimes you be don't already get infected with something but your body be they handle them very well you be they fight them and you are fine but for the moment where that immune system they get small issue you understand it's like a war like you immunity your body they fight the sick they fight the tumor the body don't they win something can happen, the body in own drop small. The tumbo don't gladi.
Okay.
It overpower the body. So now I make sometimes some people back they will say, oh me rain season not fit me. Then it's once rain at the begin sick at the begin sick. Maybe not because of all the issue then they. Okay. Then somebody mentioned guanage.
Yeah.
Somebody mentioned guanage. And the
Okay, called pets clear. That's so normal color. Yes.
Pets clear.
Mm.
Okay, somebody mentioned guanage. The pets clear. Now they not we toes there. Now between
Yes,
toes there. Now that
between
one
the toes
nine
there,
and the
yes.
pets clear. Nine. So the wet environment, the moist environment, we foot then they soak. Then tumbu there, as I say, then they thrive, then they enjoy, then like them moist environment then. So when you food soak, you cannot hose, you don't catch them, it thrive. Definitely, we see you don't hang na that food they so now. Now for cause problem, then now for make because now fungi na in the cause that one inch day. Yeah.
Okay.
What people say now fungi, and then a fungal infection actually. And they cause that one each day. So you now make you need for keep between the toes then day. If you don't come on a street, you foot soak. Where you come, first of all wash your foot because you don't know what your foot don't catch.
Okay.
So you wash the foot properly. And but I find out say people are not they bother for wipe, they're not they wipe their foot there.
Okay.
So you get for be careful and be intentional about it. You wipe between your toes, make sure those areas, make sure say they're dry. Then you are safe. You don't try for prevent yourself make you not develop this guanage. And for possible get guanage, as long as you know they try for keep that foot stay dry, it will be difficult to make that guanage stay well. Then you know for the repeat, maybe if you're not possible they wear socks. Not go they repeat your socks. The way you pull the socks, you wash them. If you don't get that guanage day, if you can afford it, change their shoes then they change their socks then they where you don't they wear that guanage day, where you don't get that guanage day na your foot.
So how dangerous can they be? The guanage, yes.
Well, I know will say it, as long as you know that issue with you, you're a normal healthy person, you're not immunocompromised. It's not.
You don't get anything for do with your toes.
Now you toe it they affect.
Yes.
Now between you toes them it they affect. It cause for make you they scratch them, it they wound, it they go deeper and deeper.
Okay.
So it can get you can get secondary infection back because then tell what they talk about so not all like for say we don't get fungal infection, bacteria self not they count on top of.
Okay.
You can get a fungal infection where it can start fine. Then when you not take care of them, bacteria back candy. So you don't get now fungal and bacterial infection.
Okay.
Then it don't worsen the problem for you. So now make where you get them, you get for try for take care of them and eliminate them. Make sure say you take care of them well as soon as possible.
Okay.
Yeah.
The program now, well, Body Talk, they come to you live from the Society for Ready Democracy 98.1 FM. Well, now with the open phone line, so people will call the number 077-981-981, 077-981-981 at the number for call and be part of the program. As today we talk about how to manage common infectious disease during the rain season. Every family for know and self waiting are some of the preventive measures them way for do where you get an infectious disease. The number for call and be part of the program now 077-981-981, 077-981-981 and the number for call or self you go now Ready Democracy Facebook page and drop in a question there. So Dr. Rahman, look again, all that's the more they at risk in terms of infectious disease during the rain season.
Okay, so in terms of infectious diseases, the people they more where they at risk. I would say we go say the extremes of ages them picking them, especially the one day where they small picking we know 12 months and less. Then big people, the old people them.
Okay.
Because they want the immune system, they at their best at their age and they. When you small, your immune system fully develop it. Then when you don't they go old, your immune system is weak. So then kind of people then they if they get infection, it can tend for be more aggressive on them compared to a normal healthy person.
Okay.
Then also person will get an already underlying condition where they weaken immunity already. Then kind of like that one, so we can get diabetes. You know, what made them get infection. You know, and even that grownish, if you know one, some man are grownish, it they start the end of amputating foot.
Okay.
So then one day, because diabetes, it they hamburg back, it they suppress person in own immunity, all that thing in there. Then people they will get sick like then HIV, then thing then they will not want to make that they get infection. Then cancer, then we don't want to make that they get infection. It will be very hard on them. Then also malnourished, you know, because this food is very important. The body need food.
Okay.
The body need food. The food now the body they use for work and carry out all in functions. So you need for eat well. You need for get all the nutrients them, vitamins them for make you be strong. So malnourished, possibly not they eat well, we malnourished. Then kind of people like the infections then came more for them. Okay. Then generally is no now people with poor hygiene. People with poor hygiene, then they at risk for catch infections. Then people them will live na them maybe slum or crowded areas that will not get good waste disposal, you know. Then they near side where they to way dirty, like maybe don't bathe inside, and they at risk for catch them thing and they